What happens to a man's body? When aggressive prostate cancer spreads to his bones, did you know prostate cancer can remain silent until it reaches your bones? Gleason score 9 means one thing: high risk, rapid spread, and urgent action. Before we dive into today's intense story, don't forget to like this video, share it with someone who needs to hear this, subscribe to the channel, and comment below if you or someone you know has faced prostate cancer. Your voice matters. How does a former U.S. president with top-tier healthcare end up diagnosed only after cancer spreads to his bones? We often assume that access to elite healthcare ensures early detection and effective treatment. But even the best resources can't always outpace one of the most insidious threats to men over 50, aggressive metastatic prostate cancer. Recently, headlines shook the nation when a prominent figure was diagnosed with Gleason 9 prostate cancer, already metastasized to the bones. The Gleason score, which ranges from 6 to 10, helps classify how aggressive the cancer is. A score of 9 isn't just high, it's a red alert. But how does it go undetected? And what does this mean for the millions of men at risk? In this video, we'll uncover the timeline of how this cancer develops, spreads, and attacks, and explore the science, treatments, and outcomes with expert insights, real-life cases, and personal reflections. Before we break down the biology and timeline of this disease, hit that like button. If you're finding this topic valuable, subscribe for more in-depth health content, and comment your thoughts or questions. We're building a community that talks openly about men's health. Part 1. The biology of prostate cancer. What if your testosterone, the hormone that defines male traits, becomes fuel for a deadly fire inside you? Prostate cancer begins in the prostate gland, a small organ below the bladder. Most men develop slow-growing prostate tumors as they age, but some, like Gleason 9 cancers, are high-grade and aggressive. Expert knowledge, Dr. Kirtland Devil from Johns Hopkins, explains that prostate cancer is typically hormone-sensitive at diagnosis. That means it responds to hormonal therapy, particularly androgen deprivation therapy, ADT. Why? Because prostate cancer feeds on testosterone. When testosterone is removed or blocked, the cancer slows or stops. But in aggressive cases, this response may be temporary. The cancer adapts, finds new pathways, and spreads. Part 2. Timeline of disease progression. Could you live with cancer in your bones and not even know it? Let's map out how aggressive prostate cancer can evolve, using both clinical insights and real-life scenarios. 0 to 6 months. Silent growth. The patient may experience no symptoms. A routine PSA test, prostate-specific antigen, may show elevated levels, but not always. Microscopic cancer may begin penetrating the prostate wall. 6 to 12 months, local invasion cancer starts spreading to nearby tissues, seminal vesicles, bladder neck. Symptoms could include difficulty urinating or pelvic discomfort, often ignored or misattributed. 1 to 2 years, bone metastasis. Prostate cancer commonly spreads to bones, especially the spine, pelvis, and ribs. Patients experience back pain, fatigue, and weight loss. This is often the first moment of real diagnosis, which is tragically late. Real example. In the recent case, the former president's cancer wasn't found until it had already spread to the bones. Given his access to regular checkups, this raises questions. Was it unusually aggressive? Was it missed? Did symptoms get downplayed? Knowledge is power. If this information helps you understand prostate cancer better, smash that like button, share this video, and subscribe. Comment below if you think more men should get screened early. Part 3. Diagnosis and Gleason score. How does a score between 6 and 10 determine if you live 5 years or 15? The Gleason score is assigned after a prostate biopsy based on how abnormal the cancer cells look under a microscope. Score 6, low-grade, slow-growing. Score 7, intermediate, mixed potential. Score 8 to 10, high-grade, fast-growing, and prone to spreading. A Gleason 9 score means the cells are barely recognizable as normal. This score often prompts immediate action, radiation, hormone therapy, sometimes even chemotherapy. Part 4. Why even rich men miss it? How can someone with elite healthcare miss this until it's too late? You'd think regular checkups and PSA screenings catch everything, but PSA tests aren't always definitive. Symptoms may be subtle or misattributed. Some aggressive prostate cancers grow in a pattern that avoids detection until metastasis. Scientific evidence. A 2020 study in JAMA Oncology found that up to 30% of high-grade prostate cancers are missed in early PSA screenings. African American men, for example, have twice the mortality rate from prostate cancer, partly due to more aggressive disease biology. Part 5. The role of testosterone, 2601 to 3100. Can your own hormones turn against you? Prostate cancer is powered by androgens, especially testosterone. That's why hormonal therapy is the first line of treatment for metastatic prostate cancer. It can shrink tumors, delay progression, improve quality of life, but long-term ADT has side effects: bone thinning, osteoporosis, fatigue and muscle loss, depression due to lower testosterone. This brings up the emotional and psychological toll that's often underreported in male cancer patients. Part 6. Current treatment options. What do you do when your cancer has already reached your skeleton? Treatment for metastatic Gleason 9 prostate cancer usually includes 1. Hormone therapy to suppress testosterone. 2. Proton therapy or external beam radiation. 3. Chemotherapy, especially if hormone therapy fails. 4. Bone-targeted agents like bisphosphonates to prevent fractures. At institutions like Johns Hopkins, proton therapy is used to deliver precise radiation while sparing nearby tissues. Real outcome. Many patients live 5 to 10 years even with metastatic disease, if treated aggressively and early. Part 7. The mental battle. What's harder, the cancer or the constant fear that it might come back? Cancer doesn't just attack the body, it destabilizes your entire identity. For powerful men like former presidents, it's also a political and public burden. Mental health support is crucial, especially when dealing with fear of death, sexual dysfunction, public perception. Studies show cancer patients with strong support networks and mental health counseling do significantly better overall. If you or a loved one is battling prostate cancer, comment your story below. Let's support each other, and don't forget to like this video, share it, and subscribe for more life-saving information. Conclusion. What happens when cancer sneaks in and grows undetected until it's too late? Prostate cancer, especially the aggressive Gleason 9 type, is a silent predator. It feeds on testosterone, hides behind subtle symptoms, and can metastasize rapidly. Even those with elite care aren't immune, but early screening, informed choices, and proactive treatment can save lives. The key is awareness and action. Summary. Gleason 9 means aggressive, fast-growing cancer. Hormone-sensitive cancers respond well to testosterone suppression. Early screening doesn't catch everything, but it helps. Metastasis to bone changes the entire treatment and prognosis. Mental health is as important as physical treatment. Tell us what surprised you most in today's video. Comment below, like if this helped you understand prostate cancer better. Share with your friends, especially those over 40. Subscribe for future deep dives into men's health. Together we fight smarter.